Do you know that you can chat with a therapist before starting therapy? Do you also know that you can reduce your symptoms for as soon as one session? In this video, I'm gonna show you top 10 things you wish you knew before starting therapy.
Pieds keble conservatoire, mais tu baissais mon comptoir, pour cuidado quenne dole fontier keresu.
Hi everyone, I'm Dr. Margaret Lee, clinical psychologist in California. So, if you're new to the therapy world, what are top 10 things you should know before starting therapy? Number 1, you can always request for a free consultation before paying for your first session. Most therapists, including myself, offer a free, no obligation phone consultation before committing to treatment with a client. And this is great because this allows both of you to figure out if you're a good fit for each other. Therapists have different specialization and also their limitation. And guess what? Therapists are human too, so you're gonna run into different personality, and not everyone would work for you. Well, including myself, right? So you want to use this opportunity to figure out if you're a good fit for each other. Let's say if what you're looking for is not, the therapist can offer, and myself, I make sure that I have a great network of therapists so that if you're looking for something that I don't specialize in, I can always refer you to my trusted colleagues. Number 2, your information will be kept confidential. Like Vegas, what happens in the room stays in the room. Yes, that is correct. That means it's both illegal and unethical for us to leak your confidentiality. What does that mean? That means even if you tell me that, Dr. Lee, 10 years ago I have murdered someone, but I'm not gonna murder anyone anymore. You know what? Even that information I have to keep to myself to the grave, and I'm not able to call the police on you. And it's actually illegal and unethical for me to call the police on you. And then a lot of you would ask me, I didn't murder anyone, but my mother, my father, my sister, my cousin would actually want to know how I'm doing. But you know what? Unless you sign a release of information for me to talk to them, I'm not able to even confirm or deny that you're my client. So your information is safe with me. And if you're under 18, a good therapist usually work with you and your parents or legal guardian about how much information should be shared with them. So in my practice, I only share information with the parents about anything that I would worry about that too if I'm your parent. So for example, unsafe sex practice, drug use, alcohol use that endangers you, or self-harming or hurting yourself, others in any way to protect you actually. And a lot of parents are actually very respectful about that rule as well. At the end of the day, they want you to trust me as your therapist and be able to work on your issues together. So there's always that little caveat for confidentiality for both adult and underage minors, and that is if you're telling me anything about endangering yourself or others, elderly abuse or child abuse or abuse of dependent adult, or if you're telling me that you're gonna go blow up some buildings, that is something that I cannot keep confidential as a clinician. Number 3, you can get instant help of reducing your symptoms for as soon as one session. Yes, and therapy is no longer a lengthy process that you have to spend years before getting better. A lot of therapists, like myself, are actually trained in evidence-based treatment where you can see significant results within maybe 4 to 6 sessions. Wait, but Dr. Lee, you just told us that you can reduce your symptoms for as soon as one session. Why are we talking about 4 to 6 right now? Well, one session is to help you to understand your pattern. A lot of my clients actually felt instant relief just understanding their unhealthy patterns and what's causing their concern right now. First session is already so powerful. And after the first and second session, we start delving into how to change unhealthy patterns, and these are tools, skills buildings, knowledge, and more insight. And a lot of my clients are able to reduce their stress, anxiety, or depression just within about 4 to 6 weeks. But Dr. Lee, how come a lot of my friends are in therapy for a long time? While actually long-term therapy is also helpful for other symptoms. For example, if your concern is deeply rooted in your childhood, if there are prolonged trauma or what we call complex trauma, those are symptoms that are better treated with long-term therapy. And a lot of times after short-term therapy, after my clients' anxiety and depression symptoms have drastically reduced, a lot of them want to continue to learn and grow so that they can unlock other opportunities and possibilities in life. Number 4, nothing is off limits. If there is something in your life that you feel embarrassed about, don't worry about bringing them up in therapy. For example, if you're embarrassed about your binge eating, your stress shopping, your trauma experience, those are hard things to carry around by yourself. So bring it up with us. It's actually our job to work with you to process those feelings and experience. And if you're not sure how to bring it up, just say something like, there's something I want to talk about, but I don't know how to bring it up. So us therapists will prompt you gently, like, what is it about? Right? Then it's up to your comfort level of how much to disclose. And if you're not comfortable working on them at the moment, that's okay too. We'll work together to create a safer space so that when you're ready, we can work on them together. Number 5, nothing is too light or too severe for therapy. So a lot of my clients actually came to me first session saying that I don't know if this is something we can work on together. A lot of people probably can fix it by themselves, but I can't. Then I keep telling them that, you know what? Therapy is about learning skills and self-growth, right? It doesn't matter where people are on their development, your own development is the most important. So whatever concern that you bring to therapy, you and your therapist can discuss, what's the best treatment for you, and nothing is too light or even too severe for therapists to work on. And of course, if we're talking about there's some limitation in the therapist training, then it's the therapist's judgment to refer you to the right professional. Number 6, honesty is the best policy. Let's face it, you're the one that's paying for the therapy, so why are you hiding things, right? For example, some of my clients are ashamed about their substance use, their binge drinking, binge eating, or relationship concern, financial concern. If those are the things that are bringing you stress, we therapists hopefully are able to detect it and talk about it with you. But we actually want you to bring it to the session so that we can work on your problem, holistically, so that we're not missing any critical piece. And if stress eating, stress shopping, binge drinking is the way that you've been dealing with your problem, let's see if we can develop other healthy coping, because those are critical steps in healing and feeling better. Number 7, expect to feel uncomfortable at times. Therapy is not just about rainbows and flowers and feeling better. Therapy actually is a way to learn about yourself and address some of the pain. Imagine if you have a splinter in your finger and you don't take it out. It's gonna be there. And if you take it out, it's gonna hurt when you do so. But it doesn't mean that it wouldn't heal later. You know, there's always a saying in therapy that if it gets worse before it feels better. And that is actually very true. It's hard, but it's worth it. Another way to think about it is like a mental workout, right? When you start working out, your muscles are sore. But then when you start picking up that dumbbell, lifting that weight just a little bit more each day, your body gets used to it and it benefits you in the long run. Number 8, don't worry about your therapist. We therapists are professionally trained to listen and help with different concerns. So if you're worrying about, burdening us with your sadness or scaring us because of your trauma, don't worry about that. A lot of us have a really good support system to take care of ourselves. Like me, I have a really good self-care routine so that every day I can distress myself after a whole day of work, and I have a support system that can provide me consultation when I need. So don't worry about burdening us or stressing us. At the end of the day, that's our job to take care of your feelings. Number 9, if you're ready to leave therapy, it's okay to bring it up. And a lot of the times, you might feel like you already benefit a lot, you don't need therapy anymore. That's great. We're happy for you. Let's talk about how to end and also how to prepare for your future. That's great, number 1, right? And then there are also scenarios when you feel like, well, I don't think we're clicking. Like, I don't feel like I'm benefiting anymore. Bring that up with us too. I have a lot of colleagues that I can refer you to if, me is the concern in, you getting your treatment. I don't want to do that, right? Like, I want to make sure you get the best care you need. So feel free to bring it up. At the end of the day, we just want the best care for you. Number 10, and the most important one, is that the benefit of therapy actually outweighs the uncomfortableness of starting therapy. Some of the most important benefits including changing your unhealthy patterns, improving your coping, understanding your past and current and how your past actually shaped your current, understanding how to reduce your anxiety, stress, or depression, improving your relationship, improving your way of thinking, you name it, we do it. So, I understand that starting therapy is very hard, and I was there, but trust me, you will actually want to start therapy to expand some of your options, right? So that you're not just making decision because it's comfortable. You're making decision because all the information you've gathered about yourself, your pattern, so that you're making an informed decision for your future. So that's it from me. Top 10 things that I wish all my clients knew before starting therapy. I hope you really enjoyed this video. Give me a thumbs up or like if you've learned something new from this video. Let me know in the comments below which tips is the most surprising for you. And if there are other things that you wish you knew in your therapy before you start your therapy, comment below as well so that other people can also learn. This channel is all about empowering you to gain more insight in psychology so that you can create a life with more inner peace and emotional freedom. More videos like this every Wednesday. Be sure to hit subscribe and I'll see you next Wednesday, same time, same place. Thank you so much for watching. Take care.